On today's Mental Health Matters program, host Andra Hollenbeck speaks with Chris Boniff, the executive director of Oregon's chapter of the National Alliance on Mental Illness, about how the program got started and how it supports families and individuals living with mental illness. Good day. Hope you are doing well today. You're listening to Mental Health Matters on the Jefferson Exchange with Jefferson Public Radio and NAMI, Southern Oregon. I'm Andra Hollenbeck with NAMI, the National Alliance on Mental Illness, Southern Oregon. When we talk about our health, we cannot discuss complete health without talking about our mental health. On this program, we highlight mental health issues in our community and ways we can improve mental health for everyone. Today, we'll be talking with Chris Boniff, Executive Director of NAMI Oregon, about NAMI's work in Oregon and particularly NAMI's role in legislation that improves mental health treatment in our state. Hello, Chris.
Hello.
Thanks for joining us on the program today.
Yeah, you're welcome. Thank you for having me.
Great to have you. So let's start with the obvious. Would you explain to folks exactly what NAMI is?
Sure. We're the National Alliance on Mental Illness, which is the acronym. We're part of a national organization. Within each state, there's a state organization. And then there's a number of affiliates or local chapters, of which we have 16 in the state of Oregon. And at the heart of what we do, we're people with lived experience. We live with mental health disorders. We're family members. We're raising children. Many of us are some combination thereof. And we deliver free education programs, classes, and workshops, and free support group models, basically for any part of a family, however you define family, that is dealing with mental health issues. Mm-hmm. And we do that in probably the world's worst business model. We do it for free. So it's really passionate people who have been through the healthcare system trying to get help, trying to give back to those folks coming in their footsteps, teaching them how to advocate for themselves, how to care for their family, how to care for themselves, and really how to get to recovery and good health.
Right. So I guess that leads to the next thing. What do you see as NAMI's role in making mental health better for everybody?
The thing about behavioral health is there's the treatment system, which is just treatment. And it really is only for the individual. It's not really for the family structure. It's not for continuing on in good health once you are out of the treatment system or in between treatments. What NAMI does is fill in those gaps. You think about it for a medical illness. When someone is in the hospital, family get to be there. They embrace them. When they talk about discharge, family is involved. How are you going to support your loved one? How are you going to, what's your next step as you living with a medical ailment? We don't do that in behavioral health. We tend to segregate. And then we send people back home. We send children back home with a family and a family structure that's ill-equipped to help their loved one. And so what we do is we fill in all that information gap. And what I like to term it is we take the hand of an individual living these things, we take the hands of family who are trying to help a loved one, and we walk with them outside of the treatment system to do and know all the things that they need to do to reach recovery and good health.
Yeah, great. So you've been executive director of NAMI Oregon for many years now, but I'm curious, how did you first become involved with NAMI?
Well, like a lot of people, I tripped across NAMI because we don't have a marketing budget. So it really is word of mouth. And I was working for a nonprofit provider at the time that is a large children's provider. And at the time, we were giving NAMI Oregon, the state chapter, free office space. And this was back around 2004. And working in the treatment system, I'm not a clinician. I'm just a guy. I live with a mental health disorder. But in my role there, I worked with a lot of families, and what you saw is such a significant disparity between what medical insurance would pay for and your insurance benefit for behavioral health. And so I started getting involved just because of the injustice of it all, and working on parity legislation, insurance parity legislation in the state of Oregon. I stayed in NAMI because, again, I live with a mental health disorder. I went undiagnosed for a long time. Like many people, my onset was when I was young and in college, and I went more than 10 years without being diagnosed. And it was the first place that I actually saw others just like me. So instead of feeling alone and isolated and wondering, why am I going through this? How am I going through this? How am I ever going to get healthy? I found others who were just like me. And it's that community and that sense of community that embraced me. And from that day forward, I really was very deeply involved in NAMI, and then eventually consumed my life. And so why not work for the organization at that point?
Yeah.
So you are listening to Mental Health Matters on the Jefferson Exchange. I'm Andra Hollenbeck with NAMI Southern Oregon, and we're speaking with Chris Boniff, Executive Director of NAMI Oregon. So that's great. Let's go into the advocacy part, because you work quite a bit with the Oregon legislature on issues surrounding mental health. What are some of the current issues that you guys are currently working on?
Yeah. So to get to the current issues, I think you have to look at the past and where we came from. And so I alluded to this. I started with NAMI back in 2004. It wasn't until 2005 that in the state of Oregon, that within commercial health insurance, that you really had to have a behavioral health benefit. So prior to 2005, you could have an insurance product through your employer, you purchase it on the open market. It excluded mental health, it excluded substance use disorders, or your benefit was so paltry that it was worthless. So that we started in 2005 in Oregon, NAMI Oregon, passing in that legislature with the help of some really leading legislators at the time, like Senator Peter Courtney, Senate President, a mandate that said if you offer insurance in the state of Oregon, your behavioral health benefit has to be on parity with your medical benefit. And so that was the start of a long journey. Between 2005 and today, we've done a lot in housing and making sure that there's more housing available, particularly for adults living with serious mental illness. We've done a lot around Medicaid expansion in the state and making sure prior to Medicaid expansions, we had a lot of adults living with serious mental illness who had no coverage whatsoever. And so when we expanded Medicaid, making sure there was parity in Medicaid and access in Medicaid, or our Oregon Health Plan. We passed a sweeping update to our parity law in 2021. And then more recently in 2023, we focused on building out Oregon's crisis system. And we have this nationally, this 3-digit number 988 that at its base level connects you to the National Suicide Prevention Lifeline Network. When Congress authorized that, they gave states the option to build a bigger crisis system around 988, and Oregon elected to do that. So in 2021 and 2023, these odd number years where the legislature meets from January to July, these long sessions, worked very much on building out that system so that in Oregon, with an Oregon area code, when you call 988, you're connected to a call center here in the state of Oregon.
Okay.
And that call center is well-versed in lifespan. They can serve everything from young families with kids up to senior citizens. And that they can do more than just suicide prevention. So that if I see something in my community, I'm concerned about myself, I'm concerned about my friend, but suicide's really not at play. It's really more like something mental health is going around.
Right.
That's a resource for you. This is a long-term project. Eventually what we'll build out and fund is more mobile crisis. So think of that as the equivalency of an ambulance service, right? If you see a mental health crisis in your community, you're experiencing one in your family, regardless of how you interact with that, you can call 988, and what we'll do is dispatch trained people, just like EMTs, but EMTs for behavioral health crisis.
Right. We've started some of that here in Jackson County. I'm not so sure about Josephine County, but yeah, and definitely see a big improvement around those areas.
Yeah, I think that will be, housing remains a huge deal, obviously.
Yeah.
Building out the crisis system is really our next big endeavor. So we as in terms of your insurance, what we're looking at this is, can we give tools to regulatory agencies to make the system better? On the insurance side, with our update of health insurance parity, we think we've given our insurance division the tools it needs to regulate healthcare plans so that we, again, begin to end this significant disparity between medical benefits and behavioral health benefits. And now we have to turn ourselves to the delivery system, which is, when we talk about crisis, there is no delivery system.
Right.
And so, but we take for granted there is on the medical side. So anywhere in our state, if you had a medical trauma, we know what to do with you, up to and including life flighting you to the city of Portland, where you have the highest level trauma hospitals in the state. Behavioral health, we have absolutely nothing. So our attention really is going to be around using that 988 framework and making sure we begin building out a crisis system.
Right, and that seems like we're really at the inception of that right now. It's not fully flushed out at this point, but it's moving in that direction.
We're getting there. So we, in this last legislative session, we successfully passed a telecom fee. So we all on our
Right.
telephone bill pay $1.25 a month for 911 services.
Right.
Starting in January, we'll pay an additional 40 cents per month for 988. And
Ah.
that will fully fund the call centers we have, and we have 2 of those in the state of Oregon. And it will begin our pathway to fully funding mobile crisis. So I dare say even in Jackson County where you have it, it's probably not there 24/7. It's
Right,
not able
it's
to answer the call every single time. And so we have to fund those things and make sure that whether you're living in Jackson County or Umatilla or Multnomah or Malheur, that that's available 24/7 when needed. And again, the equivalency is ambulance service. When we need an ambulance, it's
You
there.
call.
If it's not there, right, that is a big controversy.
Right,
And
right.
so we're trying to create that parallel in behavioral health.
Right. That sounds good. Yeah, looking ahead, what are some other hopes and aspirations you have in mind for the future of mental health treatment?
That's a good question. So some of the more discrete policy things that we're looking at, I think mobile crisis is going to be a big issue because it's expensive to do it right. And so finding the revenue and finding multiple revenue sources to make sure that that is there, again, just like an ambulance, just like a fire truck, a 24/7 infrastructure, and that's expensive. And we
Yeah.
need to have that everywhere in the state. That's going to be a complex issue as we go into the next long session in 2025. I think the other piece that we're looking at leading on is civil commitment. And so it's, in our state, it's a very high bar. So if someone we all saw, disheveled on the streets, in danger of really harming themselves over time, can't meet their basic needs, in our state, there is no way to compel that person into care. We do eventually because we arrest them. And then we put them in jail. They go in the court and they don't understand what's going on. And so we have to, under the Constitution and their constitutional rights, what we call aid and assist, we will send them to the Oregon State Hospital for a small level of treatment so they just understand what's going on around them. So we're compelling people into treatment, but we're compelling them with no healthcare goal in mind.
Right.
Because in Oregon, it's so hard on the civil side to compel someone into treatment. So we're going to look at that and see, can we rebalance that?
Right.
Why must someone compile a criminal record to access behavioral health care? That doesn't seem just.
Right.
At the same time, we don't want to overdo committing people. Right. This is a intervention of last resort that should be fairly rare. So if we do this, we have to do it right, and we have to understand that that's not the only thing. At the same time, that can't be the only thing we do. At the same time we do that, at the same time we make it easier on the civil side to compel someone into care, we have to do more to prevent them from reaching that level of acuity in the first place. Otherwise,
right.
we will never keep up. Yeah. Yeah, and I don't even think it's prevention. I think it's earlier intervention. We're not even talking about prevention yet.
Right,
We're talking about when most of us have onset when we're very young. So half of all people who live with a lifetime mental health condition have onset prior to age 14 years of age. Another 25% have onset between 14 and 26. That's 75% when people are young, and we do nothing in that age. But we know this, if we did something closer to the onset of symptoms, people don't have to get worse.
That's right.
And when you look at people who are homeless, people who have significant substance use disorders that are, say, on the street, they didn't start there. That is a long chain of failure that sometimes has taken decades, where we have missed our opportunity to prevent someone from reaching that level of acuity. So when we look forward, those are the two sides of the scales that we're looking at, and we have to put that in balance. And I think that's going to be a big thrust of our advocacy for NAMI going into the long session in 2025.
Right. Well, that sounds really good. Those are both very important issues to us. And I want to thank you for joining us today, Chris. You can find out more about NAMI Oregon at namior.org. And of course, please find more information about NAMI Southern Oregon at the website namisouthern.org or email us at info@namisouthern.org. This is Mental Health Matters. Thank you for joining us. You can find this and other interviews at jeffexchange.org or subscribe to this podcast at Apple, Spotify, or wherever you get your podcasts.